Welcome to the final lesson in medical terminology on CNM glass at Central New Mexico Community College. We have just a few last minute words to incorporate before you should get ready for your final exam. The first one is orth, and orth means straight. So sometimes people like to think of the orthodontist. So you go to the dentist just to take care of your teeth, but you go to the orthodontist to make them straight. Asthenia means weakness. So one medical diagnosis you may encounter as you're caring for patients is patients with myasthenia gravis. And when you hear asthenia, you know they have some kind of weakness. And this is an autoimmune disease that leads to widespread skeletal muscle weakness. So your patient can have periods where they're very weak and then periods where they're functioning near normal. So asthenia is the weakness. One that you know and use, but let's just make sure, edema is swelling. So if I were more specific and said to you, your patient has periorbital edema, would you understand that as swelling around the eye? So it's this orbit, around, periorbital edema, as opposed to pedal edema, where they have swelling in their feet. Emesis means vomiting. So we keep talking about these emesis basins. You learn that in NA, little basin. Really, emesis is vomiting, and those little basins are so small, I'd never want to try to actually vomit into one. So anyway, emesis, vomiting. Home means self, and hetero is other. So when you're talking about home and hetero, sometimes it's easiest for people to think of this in terms of homosexuality or heterosexual, meaning you are attracted to people like yourself of your same gender versus people of the other gender. Homo sapien, self-aware. Human beings are referred to as Homo sapiens because originally we posited that we were the only species who was aware of ourselves as individual human beings. Ger, or ger, means old. And I know you hear this a lot, geriatric. You're taking care of a lot of patients who are geriatric. They're old. They are our elderly. So when you see ger, like gerontology, people who study what we are when we get old. Pharmac. Pharmac just means drug. So pharmacology is the study of drugs, right? Pharmacist, that person who dispenses drugs. Brady, I know you know, means slow. So bradycardic, bradycardia, slow heart. Sacro just refers to your sacrum. So sometimes you'll hear sacroiliac, so between your sacrum and your iliac crest, maybe sacroiliac. Sedat means quiet, calm. So sedative, right? A sedative is a medication used to quiet or calm people. If you are being very sedate, if someone describes your personality as sedate, they're saying you are quiet, you are calm. Cerebr Cerebur is brain. And I think we've talked about this back earlier. I know I gave you tegument for skin, but did we give you cute for skin? Cutaneous, subcutaneous, underneath the skin. Trophy is development. So if I were to say the patient has hypertrophy, I'm saying higher than normal development of something. So you will hear people talk about hypertrophy a lot of times in relation to cancer, or if you're a bodybuilder and you're building more muscle, that's hypertrophic development of muscle tissue more than normal. Dura is hard. Lymph is watery fluid. So remember, our blood veins carry our blood back to the heart for circulation, but coming out of our arteries into our tissue is fluids, is water. That doesn't all return necessarily back to the bloodstream, to the blood veins for return to the heart. It can enter a second type of circulatory system, our lymph system, which there are lymph nodes scattered throughout your body, remember, to help move this watery fluid. So when we're talking about putting blood pressure cuffs on patients and we're trying to decide if they've had maybe a mastectomy with lymph node dissection or lymph node removal, we know that another channel for moving fluid through the body may be impaired, and if we put pressure on and force more blood, more fluid out of the bloodstream, there's no way for that to return through this lymph circulation, and so our patients will end up with lymphedema. They'll have this watery fluid swelling in their body because the lymph system is not returning those extra fluids into circulation. An important root that we need is emia, and that refers to blood. So when we talk about anemia, without blood, right? Leukemia, white blood. So a patient with cancer, there can be leukemia, and it has to do with the white blood cells, because you'll remember leuc is white blood. Okay? This ends the program for medical terminology. Keep studying, use your cards, and good luck.